Hi everyone, today we will be reading another article. It is lung cancer research. It is a peer-reviewed article, and the title of this one is Young Lung Cancer from Diagnosis to Survivorship. Let me show you right here. And there are a lot of authors, so I'm going to make sure to give them credit, but these are members of the Flores Lab. And the Flores Lab really focuses on women's health and young lung cancer, right? And while I read through this, there were things that stood out to me. So I wanted to put this on your radar that if you are a young lung cancer patient or have interest in young lung cancer research, it's definitely an important article to read. It is on section 6, fertility, pregnancy, and sexual health. Okay, so they say that the enhanced overall survival of young patients make it important to elucidate the effects of treatments on fertility and sexual health. However, most contemporary knowledge has been derived from research conducted in animal models from data extrapolated from patients with breast cancer and before the incorporation of novel therapies such as ICIs and TKIs, which young patients are more likely to be on. A global regulatory filings and public assessment analysis found that for female patients, 58% of ICI treatments represent a fertility risk compared to only 33% for male patients. Animal studies of ICIs have also yielded unfavorable results, including diminished ovarian follicular reserve, low maternal weight, excessive rates of abortion, stillbirth, and premature delivery. So that part is really important because I think that a lot of people will think that lung cancer patients are okay, such as me and other young lung cancer patients out there. We look completely fine. But since we are on active treatment, such as targeted therapy, others are still on chemo or radiation, those active treatments still have long-lasting effects and current effects on our bodies. And there's only been a total of 66 cases of lung cancer diagnosis during pregnancy have been reported in actual literature. Given the bleak and heterogeneous aforementioned therapeutic effects on fertility, it is unsurprising that lung cancer treatment management throughout pregnancy is far from standardized. Though cytotoxic therapy has been commonly used throughout pregnancy, chemotherapy is typically avoided during the first trimester and instead given throughout the second and third trimesters, as risks include spontaneous abortion, congenital abnormalities, and transplacental transmission of taxanes. While some cases report safe TKI use, other cases have ended in spontaneous abortion or resulted in fetal growth restriction, treatment-related malformations, and severe maternal adverse effects. Surgery may be considered in highly specific cases of early-stage lung cancer or as palliative measure for patients with extensive bone metastasis or those at risk for spinal cord compression. And I actually went through this whole thing and had my own notes and wanted to explain it in a more accessible manner. So I actually wrote down my own notes just to be able to explain this article and this section better. And the source is the article, I will link it below, but there are fertility risks from treatment, and many young patients with lung cancer are treated with newer therapies called immune checkpoint inhibitors, ICIs, and tyrosine kinase inhibitors, TKIs. But unfortunately, these treatments may affect fertility, especially in women. In fact, nearly 60% of ICI treatments pose a fertility risk to women compared to 33% for men. So, animal studies suggest that these drugs can lower the number of healthy eggs, ovarian reserve, or increase chances of miscarriage or stillbirth, cause long-term hormone problems, and TKIs have also been linked to damage in egg development and early pregnancy health. But we still don't know enough about the effects of newer versions of these drugs, especially in humans. So remember, these are notes that I got directly from the article. They're not my own words, but they're just my notes, and I tried to make the language more accessible. So only 66 cases of lung cancer diagnosed during pregnancy have ever been reported in medical literature. This means we don't have a clear or consistent treatment plan for pregnant patients. Some treatments, like chemotherapy, might be safer in the second and third trimesters, but carry big risks early in pregnancy. Even newer treatments, like TKIs, have had mixed results in pregnancy, with some cases ending in miscarriage or fetal complications. Surgery might be considered in specific cases, but radiation is usually avoided because it could still reach the baby. Specialized imaging like PET scan or the MRI is preferred to monitor cancer during pregnancy. And yeah, so far that is what the fertility section had. And I think, just from my experience as a young lung cancer patient, it's kind of I wouldn't say taboo, but the conversations aren't always there in regards to fertility and in regards to us patients that haven't grown families yet. I've met people who were pregnant and were diagnosed with lung cancer, but there's not quite a lot of research as well in regards to those that were diagnosed prior to being able to be pregnant. Yeah,